I'm going to take my next towel. I'm going to add water. And I'm also going to add soap. And I'm going to clean from front to back, starting at the top of the vagina, past the rectum. I'm going to take my second leaf. I'm going to start at the top of the vagina and clean past the rectum. I'm going to take my third leaf and I'm going to start at the top of the vagina and I'm going to clean past the rectum. I'm going to place this towel to the side. I'm going to take the next towel and I'm going to add water only so I can rinse off that soap. I'm going to start at the top of the vagina and I'm going to rinse past the rectum. I'm going to take the second leaf. I'm going to start at the top of the vagina and I'm going to rinse past the rectum. I'm going to take the third leaf and I'm going to start at the top of the vagina and I'm going to rinse from front to back past the rectum. Going to provide her with some privacy. I'm going to take my last towel and I'm going to pat her dry. I'm going to start at the top of the vagina and I'm going to pat dry past the rectum. I'm going to take my second leaf. I'm going to start at the top of the vagina and I'm going to pat dry past the rectum. I'm going to take my third leaf and I'm going to start at the top of the vagina and I'm going to pat dry past the rectum. All right, Miss Tracy, we have completed your perineal care. I'm going to help you get back onto your back on the count of 3. You ready? 1, 2, 3. Good job. I'm going to uncross your legs. Now I am going to lower your arm, return you back to a position of comfort. And now I'm going to remove your bath blanket and bring your covers back up to the top of the bed. All right. I have your covers back up to the top of the bed. I've removed your bath blanket. Tracy, I'm going to give you your cowl light. I'm going to elevate your head of the bed and I'm also going to lower your bed. For safety, wise, step away and discard your bath blanket and your towels. You doing okay? All right, you feel much better now, huh? Okay. All right, Tracy, I'm going to open up the curtain. I'm going to open up your privacy curtain. I am going to discard of the towel and the bath blanket and the dirty linen. I'm going to return my working space. I'm also going to return my soap. I'm going to take my basin and I'm going to rinse and dry my basin. I've dried my basin and I'm returning my basin back to its storage area. Now I am going to remove my gloves. I'm going to take 2 fingers and place it under the cuff of the opposite glove and ball the glove up in my hand. I'm going to take the other 2 fingers and place them under the cuff and ball them up in my hand. I'm going to take the gloves, remembering that the inside of the gloves are clean, and I'm going to discard them. All right, Miss Tracy, you have your cowl light. I'm going to work on your presentation here to make sure you're centered in the bed. You have your cowl light. I want you to push that red button if you need me. I'm going to step away and wash my hands. I'm going to come over to the sink and I'm going to turn the water on. First, I'm going to acknowledge that the outside of the sink is contaminated. I'm going to turn the water on and get it to a temperature that's comfortable for me. I'm going to wet my hands first and I'm going to add liquid soap. I'm going to wash my hands, keeping them lowered in the sink. I'm going to interlock my fingers. I'm going to clean the outside of my hands. I'm also going to clean my wrists. Don't forget your thumb and your pinky. You want to clean the outside of your nails and scrub your nails against the palm. You want to clean your hands for 20 seconds. Know that hand washing is the most effective way that healthcare providers can practice infection control. You're going to rinse your hand. You want to refrain from splashing the water. Just let the water drain. You can use as many towels as you like in order to dry your hands. Remember, after you have washed your hands, please don't touch the sink. This will cause you to contaminate. Remember, the sink is dirty. You want to take a new towel with one hand and turn the faucet off. You want to discard that towel. All right, Miss Tracy, I have completed your perineal care. I have lowered your bed. I've given you your call light and opened up your privacy curtain. If you need anything, please push that red button. I will exit the room now that I have completed this skill.